Governments across the globe have been forced to start reintroducing restrictive measures even as COVID-19 pandemic continues to hit their economies. From Europe to Africa, health authorities are applying different strategies to limit the spread of the virus. CGTN's Enock Sikolia takes a closer look at the difference between both approaches.
It's another critical moment for governments as COVID-19 cases surge in parts of Africa and Europe. Germany, France, Italy and the UK are once again turning to lockdowns to try and get the highly contagious virus under control, while a health crisis is looming in Africa. Kenya, for example, had its highest number of COVID-19 related deaths on Tuesday after 24 people succumbed to the virus. The number of patients in intensive care units is rising. Kenya's head of state felt he had to act.
This is not a time for popular decisions. In order to appease the public, we must choose the bold over the popular if we are truly to serve our people.
Weeks after some restrictions were lifted, the Kenyan government was forced to backpedal. The 10 p.m. to 4 a.m. night curfew is back. Restrictions on the operations of bars have been reintroduced.
Europe's #1 weapon against COVID-19 has been total lockdowns. Now, this is a strategy that is yet to be embraced by most African countries. The fear is the adverse effects such measures could have on the economies.
You're trying to balance between the livelihoods of the people and the lives of the people. In Kenya, we've struggled with the livelihoods, and that is why you're seeing we did not even at any point, institute full lockdowns where people stay in their homes, because that will have brought a completely different problem for the government. What we saw was containment of movement.
In European countries like Germany, governments have made funds available to ease financial pains brought about by lockdowns and other containment measures. Experts say that makes it a little easier for the population to adhere to government directives. With weak systems, most African countries have failed to cushion their economies and the people, even with lesser measures. And that has affected strategies employed by governments.
The whole issue of corruption on COVID funds now made this situation where the public has this belief, which is a myth perhaps, that the COVID numbers are basically linked to funds, and so it's about pilferage of funds and not about the disease.
Dr. Mwachonda says what is lacking in Africa is a whole of government, whole of society approach. He says that even though tougher measures in Europe are affecting the continent of Africa, Kenya and other states on the continent can borrow a leaf. He says cushioning the economy and the population could go a long way in ensuring people adhere to the basics of disease prevention. Enock Sikolia, CGTN, Nairobi.